Today we're talking facelift, frequently asked questions. What's a deep plane facelift? In contrast to a traditional or old school facelift, where generally you tug on the skin, a deep plane facelift is unique in that you get under the subfacial layers of the face, release the facial ligaments, and lift things back into their more youthful position. This yields not only a more natural looking result, but a longer lasting result. What's the best age for a facelift? So everyone ages differently. It's about 40s to 50s where we start to see significant descent or fall of the mid face, some formation of jowls, and then laxity in the neck. So 40s to 50s is when we start thinking about facelift, but we can do facelifts into the 70s, even 80s sometimes if you're healthy. Obviously, if you have the procedure earlier in the aging process, 40s to 50s, your before and after is going to be less dramatic. But if you have it later in life, you're kind of missing out on that chance to have those results while you're young, feeling spry. So it really just depends on the aging process for you, which is typically genetics and some lifestyle, but then also what your goals are aesthetically. And is a neck lift done in combination with a deep plane facelift? A large majority of patients, yes, the neck is addressed at the same time as a facelift. So technically it's a deep plane facelift and a neck lift concurrently. Reason for that is that a significant portion of aging occurs in the neck, particularly the midline, and we can't access these structures and give you that crisp neck and jawline unless we put an incision right under your chin and address the substructures of the neck surgically. What's the average downtime for a facelift? Everybody is so different, but generally speaking, it's good to plan for a minimum of 2 weeks off or away from social activities, up to 3 to 4 weeks. What are the risks of a deep plane facelift? Swelling, bruising, bleeding, infection, asymmetry, and damage to the facial nerve. Where are the incisions placed for a deep plane facelift? On either side of the face, and then generally a small one under the chin. The ones on the side of the face are hidden along the hairline, wrap right around the ear structures so that when they're healed, you really can't see them very well. And then we go behind the ear and along the hairline. Am I a good candidate for a deep plane facelift? Best candidates for a deep plane facelift are healthy adults, non-smoking, ideal body weight, who have realistic expectations about the before and after and are able to tolerate some downtime after the procedure.